Okay, I'm going to get started. Let's see, make sure this is all going. Okay, looks good. Okay, these are open office hours. I think it looks like it says it's streaming. I want to make sure. Perfect. Yep. Okay. So open office is at 6 p.m. on Tuesday, Pacific Standard Time. And I want to I always go through this every single time because I think it's important for people who are new to office hours. I'm so sorry. Sorry about that. New to open office hours, basically open office hours are a chance for me to sort of do some educational content to provide value so that people can kind of know what I do and cover different topics in women's health. So the first half of open office hours is just a webinar format, and it'll be either me that'll talk for 30 minutes, and I usually do a PowerPoint presentation about a topic. Today is about hormone testing. Or I'll have a guest that'll come and speak to us, and it'll be the entire hour, and you'll just be able to ask her questions. I say her because it's usually her. Ask the guest questions and kind of get whatever you'd like from that conversation to just, kind of a really interactive chance for you to ask questions about whatever topic that they're talking about. Next week is going to be the holistic nutritionist. So she is going to come on, and actually I think she's going to do a demonstration or a workshop about some really easy breakfast ideas, because recently it's come up that a few people have struggled with breakfast and how to get a healthy choice for breakfast. So she's going to do a presentation and an interactive some options for breakfast that are really easy and good for your hormones. So she'll be on, and her name is Elise Harlow of flourishedtable.com. And then the second half of this open office hours is always people in my practice who part of the practice is getting access to open office hours every Tuesday. So every Tuesday, I pop on for at least 30 minutes, it can be up to an hour, depending on whatever we're talking about. And if you're a member, if you are in my specialty practice, then you can ask me whatever, or you can ask other people in the membership, whatever you're comfortable with. It's a great way for us to sort of bounce ideas off of each other and really give an opportunity to have support in between your visits. So that's afterwards. So if you're in the practice, you're going to hop over to the Zoom link that you get with part of the practice. And the open officers are always voluntary. They're always we're talking about each other's struggles. So we want to be respectful. We want to make sure that we're non-judgmental and we're, open. So why do I do open office hours? I really think it's important that people get information about what an integrative approach is, what it means, and knowing that you have choices, knowing that you have options. If you, like last week or 2 weeks ago, I talked about anxiety. Today we're going to talk about hormone testing. A lot of women don't know that it's more than just blood tests. There are more options. So giving information out and also making sure that people know in the open office hours that they're not alone and that there are other people that are feeling the same way. So my ideal model of healthcare involves health visits, which are visits with, they could be doctor, chiropractor, acupuncturist, community to help support each other, and ongoing learning. And this is one of those ongoing learning opportunities to continue to provide information. So I'm going to talk about hormone testing because I frequently get asked, is it my hormones? Do I feel exhausted, brain fog, all these symptoms? Is it my hormones? And so what to understand the difference between what you can get in a traditional office, your primary care doctor or your OBGYN or whoever, and then what we provide as functional medicine, integrative medicine doctors is different. It's advanced specialty testing. So it's advanced testing to look for more causes. So I like to just sort of go through that because I think that's an important distinction that not everybody understands. So symptoms of hormone imbalance, I just put some of these. Remember that there's a ton of different symptoms. So the most common ones that I see people for in my practice are brain fog, irregular periods, weight gain, acne, moodiness, fatigue, chin hairs. We're talking about particularly PCOS, a lot of symptoms. I tend to, and when you go to your primary care doctor, they often, I really don't like that they do that with the Google Slides, kind of puts things together like that. I apologize for the scrunched words on the left. But when we look at causes, we often try to categorize what are the symptoms and what are the likely hormones that are not balanced. So oftentimes you see people will describe sort of low estrogen states, high estrogen states, those kind of referring to the hormones, the levels that they would be high or low. So a common symptom of low estrogen state would be low libido, vaginal dryness, brain fog. Clearly, if you're in menopause, this would be lack of cycles. Vaginal dryness is fairly common. Sometimes people also have difficulty with just not having any interest at all, very low interest in activities. And so that leads to sort of anxiety and depression as well. High estrogen, or sometimes referred to as estrogen dominance. Often people have tender breast, feel very moody. They can often have more cysts, more pain with endometriosis, more PCOS symptoms, weight gain. And then high cortisol is those folks that are wired and tired. So they are wiped out during the day and then they try to sleep and they just can't. So they often have very low energy, have a difficulty time sleeping, and difficulty during the day feeling fatigued. High testosterone is evidence of hirsutism, or chin hair, acne issues, irregular periods. Most common cause of high testosterone is PCOS. Low progesterone can often lead to shortened cycles, irregular moods, bloating. Most women will describe this sort of feeling bloated. And sometimes having terrible PMS or PMDD symptoms is associated with low progesterone. And then low thyroid is constipation, depression, hair loss, incredible fatigue, and then certainly some metabolic issues, weight gain for sure. So we tend to sort of in the traditional world, and that's sort of your when I say the word traditional world, I mean, your OB/GYN or your primary care doctor that you typically see. We tend to look at these and sort of say, okay, what is the thing, what is the deficiency in the hormone, or excess in the hormone? And so oftentimes we sort of make a decision about what to do because we're saying, well, if you have irregular hormones, why don't we give you a birth control pill? Because the birth control pill has a set amount of hormone every single day. So if you have high or low, it doesn't matter. We're essentially going to even it out by giving you a set amount. Your ovaries will not make extra, and they will also not feel deficient because we're providing what they need. But oftentimes women still have issues. And so you really don't want to guess on what's going on. You really want to test and see. It's much better to sort of go about it and actually proving, do you have low progesterone or low estrogen or high estrogen, whatever it is, and not guess, because it can sometimes be frustrating for the patient. So some of the hormones that we typically test for, I've had this slide before. Insulin, obviously looking for metabolic problems. Insulin is that hormone that allows glucose or sugar to go into the cells for energy. High insulin states often are insulin resistance, but ultimately end up in diabetes. Estrogen is sort of the main hormone player in the female sex hormones, and then progesterone being the sister hormone. Thyroid, which is secreted from the thyroid gland, and then cortisol, which comes from the adrenal glands. And testosterone, which can be actually made in several different tissues in the body, adrenal glands, ovaries, fat cells. It can be actually, it's produced in a lot of different tissues in the body. So what tests do I order? When someone comes to me and says, I'm pretty sure I have something going wrong and I have something with my hormones, and what do you do? So I always start with conventional blood work. So often start with what you normally would get at any, primary care doctor, OB/GYN office, because blood work is the standard and it is the standard in practice, but also it tends to be covered by insurance. And often you can get a lot of very good information, especially when you're evaluating thyroid and metabolic hormones. So it's important to sort of start with that because you may still have a sex hormone imbalance, but if you certainly have higher insulin resistance, we need to address that as well. So I typically start with that. Every woman should have actually baseline labs every year that include these labs that I'm going to mention on the next slide. And I break them down into categories so it makes more sense as to what's irregular. So let's look at that. So sex hormones, and I'll talk a little bit why I put the asterisk there, is really because I think that advanced testing like the Dutch test or saliva test can be really beneficial for sex hormones specifically. But if you're just doing a basic workup because you want to know if someone has PCOS, You want to know if they are in the the postmenopausal range, or you're evaluating them because they're trying to get pregnant. Then basic blood work is good for evaluating the sex hormones. Metabolic hormones, fasting insulin, fasting glucose, and a thyroid panel. I use fasting insulin and glucose because I can get a ratio to understand whether or not someone has insulin resistance or not. That's really, really important to know, especially if you have PCOS, and should be done every single year, because you want to know if someone is trending that direction before they actually do start having severe symptoms. So I often get fasting insulin, fasting glucose, and then a full thyroid panel. So that's a TSH, free T3, and free T4. Sometimes I do order thyroid antibodies, especially if someone's trying to get pregnant. It's important to know that some women can have thyroid antibodies that are elevated and their TSH is normal. Hello, me. And then they really struggle with infertility because their thyroid antibodies are elevated. So they're already having this sort of subclinical hypothyroidism, but has not made their TSH abnormal yet. So important to evaluate that for sure if you're looking for pregnancy. And then cardiovascular risks, it's part of standard practice to have a blood count, your cholesterol panel or lipid panel, hemoglobin A1C, which is a reflection of what your sugar looked like for the last couple months. And then CMP is sort of your metabolic panel, looking at your kidney function and liver function. Can tell you obviously a glucose level too. If it's super high, they're probably diabetic. But ultimately, these are sort of the labs that the bottom two, especially the metabolic and the cardiovascular risk, should be done on every woman, especially if you're over the age of 40. You should be definitely having that evaluation. The sex hormones usually are very specific as to what we're testing for. Do we want to know if someone has good ovaries or good eggs? Then we're looking sort of at FSH level or AMH level. So kind of just depends on what we're looking for. Which day is best to test? So every lab, really, really important to know what cycle day you are, right? Because if some labs are not going to be accurate, then don't get the labs drawn. It's a waste of your money to get labs drawn. If you're looking at, say, day 21 progesterone and it's day 6, then you're wasting your time. You might as well wait until you actually are doing it on the appropriate time. The metabolic labs can be done anytime, in the cardiovascular risk labs as well, except for lipid profile. You got to remember you have to be fasting. So you can do it any day of your cycle, but you can't eat before it. For the sex hormones, day 3 estradiol is important for evaluating someone who's potentially trying to have a baby or getting pregnant. And then peak estradiol levels for bone mass. Sometimes we do those when we're evaluating someone for perimenopause or postmenopausal symptoms. And day 21 progesterone also you need to check it after day 21. DHEA and free testosterone can be tested anytime. So why do I typically start with the blood test? Well, they're usually covered by insurance. Blood test is ideal for peptide hormones. So there's well-established ranges. There's lots of good data to support what's normal, what's not normal, and it is part of the standard of care. So it is pretty, I should say standard. I shouldn't say standard of care because these other tests are standard of care as well, but part of the standard of what people are used to. Metabolic hormones, remember, can be tested any day, and then cardiovascular labs as well. So I want to just bring this topic up because I think it's important to talk about the sex hormones, because I do think there is definite application when functional tests are better than the conventional blood test. And when is this? So when blood testing doesn't actually reflect the pulsatility of the hormones. So during the day, you have peaks and you have valleys of both estrogen, progesterone, and testosterone and cortisol. And a blood test done at one moment in time, you really don't know, is my estrogen level normal because it's at the peak, or is it at the valley? And which would be really good if it's normal, right? Because that means you're definitely normal at the peak. I mean, where are you? And so it doesn't allow you to get any information as to what happens during the day. You also have no data as to what happens to the hormone as it's broken down, when it's broken down by the liver, when it's broken down by the intestine. You don't really know where it goes. So a lot of hormones are either aromatized from like testosterone to estrogen, or they're broken down into their metabolites, but you really don't know because all you're getting is a free hormone level. I'm sorry, a free and bound level essentially in blood, which is actually number 3, where when you measure a hormone, peptide hormone level, you're actually measuring both free and free and bound hormone bound to proteins. And so you're not getting accurate measurement about a free level. So I think there are limitations to blood testing because you don't know what happens during a day, especially important when we're talking about women who are having perimenopause or menopause symptoms. You also don't have any idea what happens when the hormone gets broken down, and you certainly don't have any idea for free levels. So this is something that also thyroid can come up to. So sometimes people do alternatives to just getting it done by their provider. So there are companies like Everlywell, which is an online company where you do not order it through your doctor. You can actually literally order it from the company. So if you didn't want to get your labs done in your doctor's office, you can actually get those metabolic hormones and those cardiovascular risk hormones done online. Like there's providers that you pay for the kit and the provider orders it online and sends it to you, and they reasonably priced. I mean, most of them were between like $75 and $100, which is pretty reasonable considering these panels can be that much at LabCorp or Quest. And then the alternatives to doing serum testing are the saliva or Dutch test. And we're going to talk about those in detail because I want to sort of show you an example of what those mean. So specialty hormone testing, that's what a functional medicine or integrative medicine doctor is trained to do. We're able to not only do the standard conventional blood work that you can get at LabCorp Quest, but we could also do these specialty testing. So one of these is by Precision Analytical called Dutch test. The Dutch test, they have several different variations of the Dutch test, Dutch complete, adrenal Dutch, it's a couple of them. And then they also have something called cycle mapping. And the most important reason why I like these is because I have seen people who had normal blood tests. So their estrogen level looked normal, but they still had symptoms. They had all kinds of problems with their period. They had weight gain, brain fog, just didn't feel right. And I've seen abnormal Dutch tests. So I think it's really, like I mentioned, really important to know that you have a lot of tools in the toolbox when it comes to hormone testing, especially if you're working through a functional or integrative medicine provider, because we have both the traditional and also these specialty tests. So we're going to talk about the Dutch test. So the Dutch test is it's a urine test. So it's called Dutch test because it's dried urine test. And what it looks at is not only the hormones, estrogen, progesterone, testosterone, cortisol, all those main sex hormones and cortisol, but it also looks at how they're broken down. So how much do you have of each of these hormones? And then their pathways as they're supposed to be broken down by the liver and the intestine and ultimately gotten rid of essentially. And also when like on certain hormones like testosterone, do some of that testosterone get converted to estrogen? So it's a really good way of sort of understanding what's going on in someone's body. So I'm actually just showing you my test results because of HIPAA. I want to make sure that I am conscious of patients that I see. So I thought I would show you my test. So this is my test. You can actually, so I proved it up here. Here's my name, date of birth. And so you can see from my results, and hopefully you can see this okay. So this looks at these little dials. They're little dials, and in this marker where you see it has a red and a yellow here, these little markers are what my lab results are. And you can see here's the estrogen level, super high, progesterone level, super low, testosterone level, normal. And I'm going to show you the second half of this, but I actually did the Dutch test because I turned 45 this year and started noticing that I was gaining weight and started noticing that I was kind of really wiped out and just feeling kind of fatigued and not off of my usual routine, and also just kind of feeling down, like not really myself. So I thought I'm going to do the Dutch test and see what this result. So not surprising given that I have PCOS, as most of you guys know, that I have high estrogen and low progesterone. Age alone, this is actually fairly common. This is why women have irregular cycles in their 40s. They often start gaining weight. They often talk about sort of their cycle length getting shorter. And these actually reflect a lot of sort of just age-related changes, and certainly PCOS makes that worse. The other really interesting thing about this test, so just so you know, I got an estrogen level blood test. It was normal. I also got a cortisol level, which was normal, which backs this up. Because if you look at my 8 a.m. cortisol, which you may or may not see, it's normal. So when you do cortisol testing through your standard doctor's office, they do an 8 a.m. cortisol level. So it doesn't measure the whole day, but I would normally pass this test, which I did. But if you can see or not, basically mine peaks and it goes like plummets. So it goes low, 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 even lower than the actual low range. So pretty stereotypical of someone who has adrenal fatigue or adrenal dysfunction, whichever word you prefer, but essentially having enough in the morning and then just kind of really falling off as the day goes on. So, I did pass the typical blood test and ultimately was actually finding what was wrong by using the Dutch test. So in my results, let me see if it shows you. Oh yeah, I'll show you the second one. So let's go back here. So this is the second half of the page, which is really interesting because this is the pathway, this tan colored section that I was mentioning, where it talks about how things are broken down. Because with someone who has high estrogen, like I mentioned on this other slide here, you can see I'm in red, I'm like way off the normal range, then you want to know, where does this estrogen go? Like, is it broken down and which pathway is it broken down? Because we talk a lot about concern for things like breast cancer and high estrogen exposure. There are these in phase 1 detoxification. There's sort of these phases that we're looking at, this being the bad phase, hence why it's red, that we know that women that have high levels of estrogen that are going down this pathway, we get concerned for long-term sort of DNA damage, which ultimately puts them at higher risk for breast cancer. This is also something that you can see on like genetic testing. So it's important for me to know that really high estrogen level, where is it going? Where is the pathway for breaking this down? And you can see from the results that most of mine goes through this pathway and this pathway, and less in the bad pathway, which is good, right? And you can definitely see on the more common pathway down here, it's a protective pathway, that ultimately I also have a clear methylation issue. See how it says low methylation. So when that estrogen is made in excess, I'm going to just show this, and this is too complicated to kind of go through in detail, but in the liver, you break phase 1 of sort of breaking down the estrogen is in the liver. And in that, there are 2 sort of phases that it's going to go through. And in the methylation phase, there are several different pathways to which you can go through and break down the estrogen the way it's supposed to, related to these enzymes, right? These enzymes appropriately functioning. So on my results, you can see that I had low progesterone, high estrogen, and low cortisol in the afternoon. So essentially, my estrogen is not being balanced by my progesterone. And you could argue that the estrogen is too high, the progesterone is too low, or the progesterone is not high enough to match the estrogen. However you want to look at it, doesn't matter. The more important part is they're clearly not balanced. And I have clearly an adrenal dysfunction issue. And my thyroid, I wanted to put this in there because I think oftentimes when people come to you and they say, oh my God, I'm wiped out, I'm exhausted all the time, I'm fatigued, I have low energy, I can't sleep at night, even though I'm tired, especially women in their 40s, we often check thyroid labs and they're normal. And then the patient says, I'm so frustrated, my labs are normal, what else could it be? And so many times do I hear this same exact pattern that I'm describing, that I'm showing you, and it's usually a low progesterone level. So if you're someone who's had normal thyroid labs, but you're exhausted and you're having other kind of sort of hormonal symptoms, you really should think about getting a Dutch test. Okay, so I talked about the Dutch test here, detoxification, and then treatment. Okay, so the reason why I brought this slide up too, because there's so many different ways for treatment. So I said I sort of have a poor methylation pathway. So this is probably a little too small, but there are different enzymes that break down different parts of this this pathway. And so when you're looking at treatment, you're trying to figure out, where can you fix that methylation issue? Is it a So you can see these amino acids down here. Is it an amino acid issue that you're going to hit it at the amino acid level, or is it a enzyme issue that you need to replenish someone's like SAMe enzyme, or do you want to get the pathway to be pushed over and you need to give them glutathione to help detoxify what they were doing? There's a lot of different ways to treat someone who has poor methylation. That's why it's really important that someone understands sort of the testing that's done and where they can go. Is it strictly a diet thing? Can you add certain things to your diet, or do you need to be on like supplements like magnesium to help you get through the pathway appropriately? So I just wanted to show you this because it is complex as to how to help someone who ultimately finds out, that they have sort of an inability to kind of break down those molecules. So for this patient, then I chose, so low progesterone, the way I treated it was the options are chasteberry, which is an herb. It takes several months to kick in. Vitex is the Vitex berry. Or prometrium, which is the normal medication you can, not say more, but it's a medication you get through any doctor. OB/GYNs are very familiar with prometrium. I chose to use the herbal chasteberry, which is Gaia Herbs is the company that I like. To lower the estrogen that's high, I chose to use a DIM supplement, which is really a natural, you could do this through natural DIM, which is sulforaphane, which is like broccoli, the broccoli family, collard family, cauliflower, because it actually helps break down estrogen in your gut, help you kind of get rid of excess estrogen. But they do sell DIM supplements. And then to nourish my adrenal glands, I need to work on stress management, but I also need to add adaptogens, which allow my body to adapt to stress. So it helps me sort of deal with the stressors that are going on. So you can see from just kind of knowing that, if I was someone who had gone to my standard OB/GYN and my labs, my estrogen levels were normal, my cortisol levels normal, I would miss out on all this information that can ultimately let me treat this and to kind of get better in balance and have less of those sort of hormone symptoms. So I think it's important to know that's what the advantage sort of advanced testing. So cycle mapping, this is very similar, exactly the same thing the Dutch test offers, but it does it over a 28-day cycle. And so it's very good for evaluating fertility, how you can boost someone's fertility naturally. And certainly good if someone has very irregular cycles to figure out where is the, is it low progesterone or what it is that you can help their cycles. Okay, so the goods and the bads, pros, you get a lot of good detail on what is actually going on. It's a very easy test. You pee on these little strips, very simple. The con side is it is a test that costs money that's typically not covered by insurance. So it's about $250. Saliva test is the next one I want to mention. I'm just going to mention these two hormone testing because this can get a lot more complicated, but saliva testing is also fairly common to use for hormones. The company I like is called ZRT. You do measure those hormones 4 times a day, similar to the Dutch test. So it evaluates you in the morning and then midday, afternoon, and evening before you go to bed. And I do use this a lot for women on hormone replacement therapy because it gives you very good levels. And I'll show you what the report actually looks like. It gives you the levels and the optimal ranges for someone during that particular time of the day. So I find if someone's on hormone replacement therapy and they find it difficult to know why they still don't feel like what they want to, maybe they're still having hot flashes, or maybe they're still, not feeling good, then saliva testing can often be really useful to sort of tell you where is the deficiency, what do I need to add to their hormone replacement therapy. And it's also more accurate than using blood tests, because if you're using transdermal or creams or patches, they're not always tested with blood test, because again, you're talking about sort of compounding pharmacies that don't go through the standard route. And so it's often difficult to interpret blood test with people who are on compounded. So saliva testing is frequently used with, there are a lot more people who have been tested with saliva tests than blood tests. So I find it can be a little bit easier and better information. Saliva tests, they're great for also adrenal fatigue. They have a great cortisol panel that breaks down all the different metabolites of cortisol. Great for HRT management. Con is the cost. And then also it takes time. When you do the saliva testing, if you've ever done it, it takes, that's the wrong wrong slide. When you do the saliva testing, it takes like 15 minutes to actually collect every sample because you have to spit in a tube. So some patients find that a lot of effort, a lot of time to have to do that 4 times a day. So last thing, I'm just going to end on the integrative approach. I've shown the slide every time. It's really important when I see patients to take a good history. We spend an hour together on the initial visit. I use standard testing, but then I also add advanced hormone testing if that's what they need. And then we evaluate their plan. The personalized plan really has diet, exercise, stress management, supplements, herbs, all the things that we need to address from a whole body picture. All right. So in summary, blood tests are first, typically what I order, and then specialty testing after we go through the first consult to try to figure out, does someone need more advanced testing? Because if you have insulin resistance or you have diabetes or you have cholesterol issues, then we're going to start working on that stuff first. And a lot of times those other things can be second once we have a plan. Okay, 6:31. So if you're in my practice, then we typically leave here, the big group, and we go to, and I did not see any comments come through. Remember, you can always post questions into the group if you have questions afterwards. And I'm happy to, I pop in there once or twice a week, so I can always answer them. If you're in the practice, then you're going to head over to your Zoom link that you have, and I will see you there. Have a wonderful night to everybody else.